Mr. Douglas, how are you doing today?
Doing okay, I'm doing okay.
Hey, my name is Eric. I'm going to be your nurse for today.
Okay, Eric.
If it's alright with you, I'd like to perform a head-to-toe assessment.
That's fine, that's fine.
With this, we'll be able to identify different areas of your health and different systems that can alert us to anything going on with you.
Okay.
And like you said, you're doing okay? Alright. Can you ask me some silly questions today? What is your full name and date of birth?
Full name is Douglas White, July 7th, 2002.
Alright, let me see your wristband real quick too. So I just put some hand sanitizer on for you and me, just to kind of get us all clean. Alright, that's accurate. Okay. Can you tell me where you are right now?
Currently, I'm in the hospital right now.
Yeah, and this is what the hospital setting is right now. So go ahead and tell me, do you know what date it is by chance?
Today is July 10th. The year is 2024.
That's pretty much it, huh? Alright, and one last silly question. Everybody has a different reaction, but who's the president at the moment?
Joe Biden.
That's right. Alright. And with that, I can tell you're alert-oriented times 4, 2, person, place, time, and situation. So that's very good. Alright, let's go ahead and move in with just inspecting your vital signs. Let's go ahead. Okay. Now let's assess those vital signs real quick. We'll be taking your pulse, your blood pressure, and checking your respirations. So let's go ahead and lift that left arm of yours. Go ahead and squeeze inside there. Just gonna wrap this around your arm and mark it right there where your artery is. Sorry, this might squeeze you a little bit too tight, okay?
It's all good.
Alright. And we do have a kind of automatic blood pressure right here checking this out. Alright. Perfect. I'm just gonna put on this stethoscope and assess your respirations. You can go ahead and breathe normally. Alright. So your blood pressure is 139/83. A little bit elevated. Your pulse is 66. I was able to check your respirations. They are at 14 breaths per minute. That's quite good. Are you athletic at all?
Man, here and there, I get my exercise here and there, you know?
That's quite good. Make sure you keep up with that. It's always good to have some good health. Alright. And the last vital sign I'd like to check out is, do you have any pain right now?
No pain right now.
No pain on a scale from 1 to 10, 1 being hardly any, 10 being worst pain you ever felt.
That's a 0.
It's a 0 pain?
No pain.
Perfect. Alright. Now I'll be assessing your head and scalp. No noticeable abnormalities, face is symmetrical. Ears both look good. Let me check it back. Alrighty, no noticeable balding. Hair looks good. Nothing abnormal. Alright. You mind if I check out your skin a little bit too? Skin with the normal limits of ethnicity, everything looks good as well. Alright, I'd like to go ahead and kind of assess your gaze and ocular motor function as well. So can you look straight ahead? Alright, perfect. I'm just going to assess your cardinal gaze. So I want you to look straight forward, and I want you to follow this pen line as it goes up and down, left and right, and then right here, diagonal-wise. No noticeable rigid movements, nothing involuntary, so no signs of nystagmus at all. If you go ahead and kind of look at the pen light, or rather look at my nose, I'm just going to flash the pen light twice on both sides of your eyes. Restriction. Just follow the pen light as it moves close to you. Perfect. Pupils are equally reactive towards light. Accommodations present, as well as cranial nerves 3, 4, and 6. Testing those cardinal signs of gaze. Nothing out of the ordinary. Nothing wrong with your Slur over your eyes. Alright, you go ahead and open your mouth. Let's see. Upper and lower palate looks good. Teeth are good. Lips and cheek. No abnormalities. Mucosa looks pink and moist. Perfect and good. Alright, next we're going to move towards your lymph nodes. So that's in preocular, postocular, occipital, tonsillar, submandible, submental, cervical chains, anterior, posterior, as well as supramandibular. No noticeable signs of enlargement. And was there any tenderness whenever I touched or incised your neck?
No.
Alright, perfect. Are you able to move your kind of head left and right? Perfect. Let's try up and down. Alright, any pain or discomfort at all? Alright, let's go ahead and assess your heart. Your aortic valve, please hold your breath. Very good. Pulmonic valve, Herb's point. You take a break, deep breath. And out and hold. Tricuspid. And aortic. Alright, deep breath. We're going to do it once more, this time with the bell of my stethoscope. Deep breath once more. S1 and S2 are present. I'm going to go ahead and feel real quick. No noticeable signs of heaves or thrills. Going back towards the neck, I'd like to try to assess your carotids if that's fine. So first we'll try to feel for it real quick. Good. Taking one side at a time. Check with our bell for stethoscope. No noticeable bruising or thrills. I'm just going to check your trachea. Perfect, intact in midline. It's good. Now, how's your heart feeling? Any chest pain at all? Any noticeable kind of feeling palpation, anything like that?
No.
All right, let's go check your lungs. Any trouble breathing all this moment?
Not right now.
All right. Gonna check your front and back. Deep breath. And out. Again. And out. And out. Once more. Deep breath. And out. Once more. And out. Again. And out. Last one. And out. I'm going to percuss the back side where your T10 and T12 are for any resonance at all. No noticeable hyperactive sounds. You feeling okay? Perfect. Now we're going to move on towards your stomach. Are you having any nausea, vomiting, or diarrhea recently?
No.
When was your last bowel movement?
This morning.
This morning, no trouble with that? Everything regular? Alright, you urinating frequently? Any trouble with that at all?
No trouble.
Alright, if you'd like, I'd like to go ahead and inspect your abdomen. If you can roll up your gown real quick. Alright, his abdomen is symmetrical, no noticeable distension at all. Everything looks good. I'd like to take a listen after inspecting it. Let's go ahead and start here, right lower quadrant. Oh, I see here. bowel sounds are present. Okay, let's see. I'm just gonna feel for your abdomen real quick, okay? Is there any tenderness at all when I push down? No. No abnormal sounds at all. Alright, you can lower your abdomen, put your down as well. Let's go ahead and assess your gag reflex. Open your mouth. I'm going to lightly push this on your tongue. And go ahead and try to, there we go. Perfect. And make a cough noise as well. Alright, see that your uvula is doing its job. Nothing abnormal around it. Let's go ahead and place this down. And throw it away at the end. Can you go ahead and smile for me? Perfect. Can you go ahead and make a frowny face? Alright, can you kind of open your mouth? Go ahead and make a puffy face with your cheeks. Raise your eyebrows. Perfect, perfect. Everything's symmetrical. No noticeable signs of any kind of abnormalities with the cranial nerve. Let's go ahead and assess your arms. Let's roll this up. No noticeable kind of damage or any scratches, lesions, any of sorts. Skin's abnormal for ethnicity. Let's go ahead and assess your radial pulses. Do you have any noticeable numbness or tingling of your arms all the way down to your fingers? All right. Let's get a brachial pulse. Good. Other side. No noticeable signs of edema as well. Skin turn is very good. Retracts like it's supposed to. Checking the inside for capillary refill. Perfect, perfect. Can you shrug for me real quick? Alright, cranial nerve 11's intact. Can you lower it as well? Alright. Now we're going to go down to your feet, assessing the same thing as well. Can you pull up your legs, leg sleeves a little bit as well? Alright. Sorry for kind of invading your privacy, but I'd like to go ahead and check your legs. Alright. So everything looks good. No signs of edema as well. Same thing we sensed in your arms. Any noticeable numbness or tingling? Anything at all? No? Okay. Assess your post-tibial pulse. Pulses are intact. And do you mind if I just take off your shoes real quick? We'll keep your socks on just for privacy reasons. Thank you. Alrighty. Perfect. Pulses are good. Can you move your toes real quickly? Alright, now push your arm or push your legs up like you're kind of resisting me. Perfect. Alright. Go back. Perfect, perfect. And kind of push on your feet like you're pressing on gas pedal. And go back up. Alrighty. Can you kind of close your eyes? Move your feet kind of over here. Where's your feet moved a little bit?
Move to the right.
Okay. Now how about now?
And to the left.
Alright, awareness of the leg is kind of intact. Let's go ahead and have you stand up, please. Go ahead, Mr. Douglas, put your arms out. Alrighty, now kind of resist as I push your hands up. Good. Resist as I push them down. Perfect, perfect. And kind of keep your arms out forward like this. Gonna push you forward. Alright. I'm gonna close your eyes again. Check your wrong group. Go ahead, I'm gonna push you towards the right. Go ahead and resist. Alright. Towards the left. Perfect, perfect. Able to keep himself up and stable. Now, if you can, please open your eyes again. Try to walk straight if you can. Gonna assess your gait. Alright, now go backwards. Alright. And now try walking slowly over to where I'm pointing. And now keep your heels or your toes on and go in a straight line, okay? There we go. Perfect, perfect. No noticeable signs of gait or anything like that. Keep straight like that. I'm gonna assess your back. I'm gonna check out, see if there's any noticeable signs of scoliosis or anything abnormal with your back. No noticeable skin abnormalities. Spine looks to be intact. Nothing wrong as well. So we can go ahead and cover you up. Go ahead and turn around. And I want you to kind of put your finger on your nose and kind of touch where my finger is. There we go. Back on your nose. Over here. Back on your nose. Over here. And back on your nose. Last one. Perfect. Alright, let's try it with the left arm real quick. nose, over here, back on here. Last one. Perfect. Alright. You feel okay? Now let's go ahead and take a seat. Alright, Mr. Douglas. Well, we've about completed our exam. You feel like everything's been okay with this exam? You've given me permission and everything, so that's good. I appreciate your help with kind of assessing how you're doing. Concluding everything that's gone on, blood pressure is just a little bit elevated. The only thing I did notice, kind of with our assessment, you're visibly tired, so I'd like to kind of finish off when I can, let you kind of get some rest.
Appreciate it.
And I don't feel like anything was abnormal, you know, whenever we did our assessment, so you're looking pretty healthy. You just need kind of some rest to kind of recuperate. I feel like you had a busy day today, so we'll let you rest. Do you have any questions about what we kind of investigated here?
All right now.
All right, well, it's been a pleasure, and we'd like to see you again if we can, okay?
Yep.